If you're over 60 and your doctor hasn't tested your urine for protein lately, you may be sitting on a time bomb. Because protein in your urine isn't just a symptom, it's your body screaming for help, and the warning sign that your kidneys may be slowly shutting down. It doesn't hurt, it doesn't burn, but it's one of the earliest signs of kidney failure. And most terrifying of all, most seniors never find out until it's too late. But there is hope. Today, you'll discover what researchers at Harvard, Mayo Clinic, and NIH now agree could help stop this silent damage. A simple supplement, safe, affordable. It may even help reverse early protein leakage before your kidneys are beyond saving, but only if you start before the damage becomes permanent. Here's what you need to know. Let's start with what protein in urine really means. Your kidneys are supposed to filter your blood, keeping protein in and pushing waste out. When those filters, called glomeruli, become damaged, they start leaking protein into the urine. That condition is called proteinuria. You won't feel it, but it's dangerous. According to the National Kidney Foundation, proteinuria is one of the first signs of chronic kidney disease, and the risk increases dramatically after 60, especially if you have high blood pressure or diabetes. Even a little bit of protein in your urine means your kidneys are struggling. And if you do nothing, you begin sliding toward kidney failure, stage by stage, quietly, until the day your doctor says you need dialysis. But what most doctors don't tell you. You can take action now to slow, stop, or even reverse early kidney damage, and one compound could be the key. Let's reveal it. It's called omega-3 fatty acids, but not the kind you get from food, not the capsule you bought from the drugstore years ago and forgot to take. We're talking about therapeutic-grade EPA and DHA in the exact dosages used in clinical trials. A groundbreaking study published in the American Journal of Kidney Diseases followed 81 patients with proteinuria. Half were given high-dose omega-3s, half weren't. The results? The omega-3 group had a significant drop in protein levels in urine, along with improved kidney function markers. The reason is simple. Omega-3s reduce glomerular inflammation, help stabilize cell membranes, and lower high blood pressure, all of which directly contribute to protein leakage. And there's more. A meta-analysis of 17 clinical trials published in Nephrology Dialysis Transplantation confirmed it. Omega-3 supplementation consistently lowered urinary protein excretion across diverse patient populations. That's not speculation, that's clinical science. And yet, how many seniors with proteinuria are ever told this? Almost none, because prescription drugs like ACE inhibitors dominate the conversation. But you have a powerful natural tool at your fingertips. Tip number 1, choose the right type of omega-3. Most over-the-counter fish oils are low-dose, oxidized, or full of fillers. You want pharmaceutical-grade omega-3 with at least 1,000 millimeters of EPA and 500 millimeters of DHA per serving. That's the dosage range used in successful trials. Look for products labeled IFOS certified or third-party tested for purity. This guarantees you're not ingesting mercury, rancid oils, or synthetic additives, any of which could make your kidneys worse, not better. Tip number 2, time it with your largest meal. Omega-3s are fat-soluble. That means they absorb better when taken with food that contains fat, like olive oil, nuts, or avocado. Don't take them on an empty stomach. You'll absorb almost nothing. Now here's where it gets interesting. There's another nutrient that supercharges omega-3's effect on proteinuria, and hardly anyone talks about it. That nutrient is vitamin D3. In combination with omega-3s, it has a synergistic effect on kidney health. A study published in the Journal of Renal Nutrition showed that seniors with both vitamin D deficiency and proteinuria had the fastest decline in kidney function. But when those seniors corrected their D3 levels above 40 ng/ml and combined it with omega-3s, the rate of kidney damage slowed dramatically. Why? Because vitamin D receptors are located in the kidneys, especially in the podocytes, the very cells that prevent protein from leaking. When D3 is low, those podocytes weaken, damage accelerates. But with sufficient D3, podocytes strengthen and reduce protein leakage. Pair it with omega-3s, you get double the protection, but it only works if you know your numbers. Get your 25-hydroxy vitamin D blood test. If you're under 30 ng/ml, you're at risk. Now let's talk dosage. Most seniors need at least 2,000–5,000 IU of D3 daily, especially in winter or if they avoid sun exposure. Talk to your doctor, but don't settle for a multivitamin with 400 IU. That's not enough to protect your kidneys. Now here's the hidden truth your doctor may never tell you. Omega-3s and D3 don't just reduce protein in your urine, they may also help avoid dialysis or delay it by years. A 2021 study from the Mayo Clinic tracked seniors with stage 3–4 kidney disease. Those supplementing with therapeutic omega-3s and maintaining healthy D3 levels had significantly slower progression to end-stage renal disease. That's the stage where you lose all independence. Dialysis, weekly visits, exhaustion, emotional strain, financial burden. But this wasn't a drug trial. This was about giving the body what it needed before it was too late. No side effects, no surgical interventions, just nutrients, timed properly, dosed properly, used early. But here's a common mistake, and it could wipe out all your progress if you're not careful. Never take omega-3s with blood thinners without medical supervision. Omega-3s naturally thin the blood. If you're on warfarin, clopidogrel, or aspirin therapy, you must coordinate dosages with your doctor. Also, stop taking cheap supermarket fish oils. They may be oxidized, low purity, or too low in EPA to matter. If your product doesn't list exact EPA and DHA content, don't trust it. Also, avoid cod liver oil. It contains vitamin A, which in high doses can strain the kidneys. Instead, opt for purified triglyceride form fish oil, high in EPA. Now here's your new routine. This 5-step plan protects your kidneys and may even reverse early proteinuria. 1. Test your urine for protein and albumin every 6 months. Ask for the urine albumin to creatinine ratio, UACR. 2. Test your 25-hydroxy vitamin D blood level. 3. Take pharmaceutical-grade omega-3 with at least 1,000 mg EPA plus 500 mg DHA per day. 4. Supplement vitamin D3, minimum 2,000 IU day, more if deficient. 5. Time your supplements with your largest meal for absorption. Now let's add one bonus tip. Start walking daily. Yes, walking. Mild aerobic exercise improves glomerular filtration rate, reduces systemic inflammation, and improves insulin sensitivity, all of which reduce the pressure on your kidneys and help limit protein leakage. Just 20–30 minutes per day. No gym, no weights, just your feet, and consistency. Now let's summarize everything. Protein in the urine isn't random. It's the first sign your kidneys are under attack, and ignoring it is a guaranteed path to dialysis. But when you act early, when you supply your body with the right nutrients, you can slow or even reverse the damage. That means more energy, more freedom, and fewer doctor visits. And the two most powerful weapons, omega-3 fatty acids and vitamin D3, backed by Harvard, Mayo, and NIH, ignored by most mainstream doctors, but proven by research and real results. So if you've ever seen trace protein on your lab report, if you've ever had foamy urine, swelling, or fatigue, start this today, because once your kidneys drop below 30% function, there's no going back. Act now. Test your levels, fix the deficiencies, protect your kidneys before it's too late, because your kidneys won't warn you with pain. They'll just go quiet until they stop working.